Right here.
Sure, but like, where do you feel? Is that where you feel it?
Yeah.
Okay, right through here? Right through here?
It's probably right here.
Right here?
Yeah.
Okay. So let's draw this guy.
RP, could you explain where Graston came from? Graston?
So the history of it, I don't know too much about the history. I took the class. Essentially what they did was they used other things like pencils, and what I recall from the class was they used pencils to kind of roll through some tissue, and then eventually they became more advanced with some butter knife kind of like looking thing like this.
Got it.
Essentially what it does, a nice analogy to give you would be if you have this pillow right here, right? We have a pillow, we have the pillowcase. Now, if you imagine this pillow being the muscle, and then this pillowcase being the fascial layer, right? And imagine another pillowcase right here. And between the two layers of the pillowcases, you have nerve endings, right? So if your fascia is kind of all crumpled up and it's irritable, well, guess what? The nerves that are trapped in between these fascial layers are going to be, sending that signal to your brain that, hey, this is not comfortable. So essentially what we do is, using this Graston tool, we will sort of flatten out that fascial layer. When we do that sort of thing, these nerve endings that are underneath sending that signal of pain to your brain, you're not going to get that signal.
Got it.
You're going to feel better, essentially. So that's why you don't have to dig in a whole lot with this, which is kind of the cool part of it. Again, the pressure can vary from therapist to therapist because not everyone uses the same amount of force. But when I got certified 2 years ago, the guy who was leading the course was saying, hey, we don't no longer need to cause bruises and hurt our patients like we thought we had. He was just joking around, but essentially we don't have to put as much pressure as we once thought, because it still allows you to get the benefits of it, because the fascial layer is still pretty superficial, and we're not necessarily digging in through the muscle belly as intensely as what we once thought. So we're kind of working through the fascia mainly here.
Great.
And then you can get a little bit of that redness, but that redness is again a normal response. So in a little bit you can see it in some areas. It tends to light up, and generally speaking, the areas that do light up are the layers beneath the skin in that fascia where it is a little disrupted. So those areas tend to light up a little bit more quickly than other layers, than other areas.
Got it.
And one of the things that you want to do with Graston is, when you're doing the technique, you want to follow it up with some hamstring stretching and some sort of warm-up. So we did a warm-up prior to Brandon doing the Graston with me, and then after this I'll have him do some hamstring stretching with the dark strap here. So
great explanation.
Thank you.
In acupuncture we have what's actually a huge Chinese soup spoon, and it's called gua sha.
Okay, gua sha. Yeah, exactly. You can get that. You can get the knockoff stuff on Amazon. And we actually have one of the ones in that little. We actually have one of those pieces. It looks very similar to this.
Got it. Okay.
This just tends to be a little heavier, a little stronger material. Overpriced sometimes, in my opinion, but it is effective, though. That is why I got certified in this, because all jokes aside, it can help reduce the pain. And I usually tend to assess by having them do something that provokes their symptoms, and then doing the Graston, and then having them retry that same thing that activated their symptoms in the first place. So you can see a little bit of redness. This sort of redness is somewhat of a normal response. Bruising is not necessarily a response we are going for. Like, in some cases, people that I know, we need to get deep in the tissue.
So just for orientation, everybody, this is the hamstring or back of the leg. And it's the leg calf, but this is the hamstring, and this is a hamstring pull for this guy. In acupuncture, we have been taught to actually cause the hematosis. The bleeding. Usually we apply it to the back. It's easier to hit the trapezius. And it seems to turn on, in our theory, it turns on a lot of the meridias, and it also is a bit soothing. But I love the way Western medicine has adopted it because of the science that in the studies. And insurance always requires a reason to apply. So either way, I think when we throw in more techniques, it just facilitates the healing of the patient. So this is great.
Yeah. This is definitely nice. I mean, when I strained my calf muscle, I was like, this is all voodoo. This can't be it, you know? I mean, I was waiting at a basketball court to play, but I was on the side hoop just shooting, and this 250-pound guy basically plowed me, and I did not see him coming.
Yeah.
He didn't see me at all.
Right.
Strained my calf muscle. Fortunately for me, that's when I went to this class like a week or two later.
Oh, excellent.
And then I learned about this, and I'm like, I don't know, is this too soon to try it on me? Well, I had a calf strain. It was pretty bad. I was limping. And then after I did the Graston treatment, I feel like one of those, you know, commercial for Graston. Like, it changed my life. I had it done on me. I told the girl, hey, go ahead and do it on my calf. After she worked on it, I stood up and I walked around. Like, the pain subsided like by 80%.
Got
you
it.
know.
I can see a bit of the ecchymosis occurring,
Yep,
or
exactly.
bleeding occurring. Excellent. It's not bad bleeding, Brent. It's just a little bit of
Redness,
micro
yeah.
tear.
Exactly.
Yeah. Great.
Those little capillaries, yep.
And again, back to acupuncture, the theory is that when we signal to the body that there's been more trauma, it pays attention to the area, so it facilitates healing.
Exactly.
And I think the good thing is, it isn't going to hurt.
Yeah.
Or it's not going to damage anything or set back anybody. It's a great accessory tool.
Sometimes it will, you know, regenerate the process of healing, especially when things haven't been getting blood flow to that area. So.
Thanks, RP.
No problem.
So that was the Graston technique that physical therapists deploy for breaking up myofascial stiffness or planes, adhesions, I guess you can call it. We have that same technique in traditional Chinese medicine, and it's really skin scraping. I've also seen it in other Eastern practices, Cambodian, Chinese, or Japanese as well. And I remember one event where somebody brought their child that was having an asthma attack to the emergency room I worked at, and the doctor wasn't aware of those techniques. He just saw black and blue marks on the kid's back. So he started to think abuse, and then I had to come in and just educate everybody there on skin scraping. His was more, I think it was cupping, but still, when you don't know what's going on, you'll just see black and blue marks all over the back. And the traditional Chinese medicine approach is not necessarily for separating myofascial planes. It's to actually move energy. And going back to this ancient way of figuring out how to make somebody heal, modern medicine likes to have randomized controlled trials and proof. And also insurance will need that to figure out if it's worthy of putting on the insurance as a benefit. Now, you didn't have randomized controlled trials way back before, and it was just anecdote. So this is one of the energy channels, or this is a stimulation of the energy channels associated with traditional Chinese medicine. Specifically, Dr. Mabel Angel at AcuAngel is using the same meridians as the last time, and that's determined by pulse taking and then tongue reading. Believe it or not, that's the way it works with traditional Chinese medicine. So these are specifically placed not only for musculoskeletal spasm, like in a hamstring tear. Hamstring is the flexor muscles of the hip and knee, but it's also for moving energy. So there's twofold reasons to have it. You can see that there are, let me get closer here. These are the acupuncture needles that are probably going to be bladder, meridia, and it's just a name. It's obviously this is not the bladder. And there's also electrical impulse being applied very lightly to facilitate. It's called Electro Acupuncture. And it's more of a French technique, but still use the same meridians as 3,000 years ago. And I know a lot of people will like to see the muscle jump. You don't have to. That's the finesse of this, is you just stimulate it enough with the placement, the proper placement of the needles to unblock the meridia and help with healing. And you can also facilitate the meridians moving theoretically by using low voltage, or at least electrical stimulation. And I've always liked to turn it up to actually see muscle jumping a little bit. That's more for very acute injuries. If anything, again, going back to Western medicine, when you exhaust the muscle of all its components to contract, eventually the muscle, since it loses those components, will just become very loose. And that's sometimes how you start the healing process. So for those of you who have apprehension on these needles, Brandon, did you have how did you feel the first time? Because you'd never had this before. Was it painful? Was it irritating? Was it dull? What would you say was your opinion when you first had Dr. Angel use these things?
When she put the needles in, it felt kind of pinchy at first, but then you don't really feel anything afterward. It just feels like there's nothing there.
Got it. And then also, is it the same sensation now because it's your second treatment with Dr. Angel?
Yeah, getting the needles in is the same as like the first time.
Got it. Okay. So pinchy is a description. Is it painful?
I wouldn't say painful. It's kind of like somebody pinching you in the leg.
Okay.
For a short amount of time.
And then after okay.
Afterward, you don't feel anything.
Right. So.
And it's not even like, I'd say a pinch hurts more than this.
Got it.
It's just like a sensation.
Okay, a real pinch, like pinching the skin. So, and that's just with initiation or inserting the needles. And in UCLA, we have a push that needle technique that I learned back in the early millennium. Other doctors just do a tapping technique. So if you're going to use acupuncture, I would always say go to somebody that always practices acupuncture. I think that number one, they'll be used to that kind of healing as their language. Every healer will gravitate towards the healing system that they studied under. So Western medicine doctors, surgeries and prescriptions, and it does work. Eastern medicine doctors or traditional Chinese medicine will use meridians. Ayurvedic trained doctors will use different things that involve the chakras or the nadi points. Those are different lines. There's a couple thousand of those. But every healing system uses something different. American Indians, spirituality, and animals. So I think there's a benefit to having the person that's injured or suffering from disease, swarm them with a couple different options. Usually there's going to be a maximum benefit for each of those types of healing. And if you've reached the max, there's no problems with going even to the other systems to assist in the healing process. So you just don't want to overlap too many new treatments because if you do them both at the same time, you're not going to know if there's a bad outcome. You're not going to know which one caused the bad outcome. If there's a great outcome, you don't know which one caused or was the trigger for a better outcome. So I always do one thing, initiate it, follow through a couple of days, and then put another layer on, whether it's acupuncture, Western medicine, herbal medicine, mind-body medicine. It's always important to separate the couple. There's really no downside to this. This can even be used to help with pregnant moms and kids. So that's why I wanted to show you. This is from AcuAngel in Bloomingdale, and Dr. Abel Angel is a physician from South America, MD, but she has decided to just heal people with this technique. I have a couple others. You can always message me and I can give you my suggestions on where you are and who I use. I'm starting to get back into acupuncture again, so hopefully this gives you another way to get better. Thanks for watching. If you have any comments on who you use, that'd be great to put them down below. Otherwise, I'll see you at the next video.